Good morning and welcome to everyone. My name is Patrick O'Shea and I'm the past president of the Newfoundland and Labrador Medical Association. I'm here this morning to talk about the outcome of a project I began during my year as president to look at ways to better serve this province's seniors. I'm joined by my colleague, Dr. Roger Butler, a family physician specializing in geriatric medicine. Roger will take you through the specifics of our recommended approach to managing seniors in the acute care setting in just a few minutes. Before we get to that, I'd like to tell you how we got here and outline the key recommendations we are presenting to government to improve medical care for seniors. Last fall, I represented the NLMA during government's consultations on home care and long-term care. In our submission to government, we called for major changes across the continuum of elder care, including enhanced community-based home supports, increased long-term care and acute care beds, appropriate levels of medical personnel, and a universal prescription program, to name a few. In March of this year, with the support of the NLMA, I convened a seniors summit comprised of 30 frontline healthcare professionals who specialize in treating our elderly population. I asked them to consider how we could redesign the current medical model to focus specifically on care delivered to seniors in the community and the acute care system. The report from that summit was shared with the wider healthcare community and the public as we continue to gather input and feedback. That consultation process concluded over the summer and has resulted in our final report containing a set of 10 recommendations which we are releasing today. As you know, Newfoundland and Labrador is aging faster than any other province in Canada. This trend has placed an incredible strain on acute care facilities and on the medical management of seniors. By 2017, 20% of the people in this province will be over 65. If we look to population projections for the next decade, we know that we must change the way we deliver care to the elderly. We feel the key to delivering better coordinated quality care to seniors starts with a clear plan for improving the flow of patients through the acute care hospital system and into the community or a more appropriate bed. Bed blockage in acute care is a significant contributor to wait times in our province. In June, the Canadian Wait Time Alliance released its annual report card, which showed the majority of patients in those block beds are seniors. Seniors typically require alternate levels of care when their acute care phase has ended. Ideally, they would be medically discharged back to their homes with community support or to a rehabilitation facility. Sometimes they require permanent placement in long-term care. When there is a lack of institutional and community support for these patients, they're often forced to wait in an acute care bed. This bottleneck in the system keeps patients waiting on stretchers in the ER and in hallways and results in significant delays for those waiting to be admitted for surgery or other procedures. To address the serious issue of bed blockages, we are recommending the creation of an acute geriatric care center that is specifically designed for seniors' care within a designated hospital. This center will serve as a central intake for geriatric patients presenting to the emergency and those referred from other healthcare professionals. This will require a fully resourced team of healthcare professionals and a triage system that uses comprehensive geriatric assessment tools to enable appropriate identification of individuals at risk. It will also require an appropriate number of acute, rehabilitation, convalescent, and long-term care beds. We also recommend the creation of a 24-hour home support and emergency response service that can quickly respond to seniors' health care needs in the community. Members of that home support and emergency response team should include a family physician, nurse practitioner, a registered nurse, a physiotherapist, and a social worker, as well as home care workers and personal care attendants. We are also calling for the creation of a post-acute care service in the community for at least 6 weeks after the patient has been discharged. By overseeing the provision of enhanced home care and continual reassessments, we will ensure that patients receive the right care at the right time and in the right place. To help patients with their transitions from different levels of care, we recommend system navigators to serve as seniors advocates. These navigators will help seniors make the necessary decisions about their care and ensure they have access to the appropriate services. We can also improve the coordination of services by implementing a provincial electronic health record and the integration of electronic medical records in physician clinics. We are also calling for the realignment of the current funding model for patient care. Right now, the care provided in our healthcare system is variable, fragmented, and financed through different mechanisms. Funding must instead be aligned with the individual patient's needs and travel with the patient rather than being linked to the institutional bed. This will enable more relevant and timely care and more choices for patients and their families. Implementation of these recommendations will require significant philosophical and cultural change at all levels of the healthcare system. Therefore, a key component of our recommendations involves education that focuses on a patient-centered approach and remedies attitudinal problems being experienced at all levels of the healthcare system. Many of our recommendations represent a departure from current practice. However, a great deal can be accomplished with minimal additional cost or no additional cost through realignment of resources that already exist. There is a great deal of expertise in our healthcare system. National benchmarking already exists, and the assessment, monitoring, and evaluation tools required are readily available. That is why, in our final recommendation, we are calling for the creation of a geriatric interest consortium of healthcare professionals to oversee the implementation of these recommendations and provide expert advice to government and the regional health authorities. This consortium should be comprised of registered nurses, nurse practitioners, physiotherapists, occupational therapists, social workers, and physicians. These professionals work on the front line of patient care and must be included in policy decisions. Of course, change of this magnitude will require political will and commitment. We are calling on all three provincial parties to support our recommendations and make a commitment to begin implementation within a reasonable time frame. Physicians of this province are eager to work collaboratively with government and the health authorities to ensure seniors have access to the best possible care when they need it and where they need it. I'll now turn it over to Roger, who will take you through our proposed medical model for seniors care.